My biggest fears were for my family. My youngest son was only 13. My eldest had been going through a traumatic event. So they really needed their mum around. And I tried as hard as I could to be brave, but you know, with a cancer diagnosis, there's just so much uncertainty and you have no control over what's happening. I remember the first time I met Michiko very well. It was in that really difficult period between diagnosis and surgery. You know, knowing you had cancer, but there was still a process, there were tests, there was a bit of waiting around. So that first call came at a really critical time for me.
People's experience with breast cancer is always different. For Elisa's case, she is a wife, she is a mother of 3 children, and she also works. So it was so much pressure on her shoulder to alternating her daily routine, and it's quite challenging for her to adjust her routine daily activity.
My relationship with Michiko was really important. She became my confidant, my counsellor, my guide. There was just so much value in having her just even listen to what I was going through, because that active listening just helped me to process everything. Breast cancer is a mental challenge just as much as a physical one. So early on, Michiko was able to help me navigate some of those difficult decisions that I needed to make, and she also showed me how to do all the rehab exercises that would aid my recovery. And then from there, it was about keeping me positive and resilient through the rest of treatment. And for me personally, on the day of my surgery, I found out that Michiko and Claire were the very same McGrath breast care nurses that had supported my mother 10 years earlier. So it was a really wonderful connection to make on an overwhelming day when nothing was familiar. I think as you go through a breast cancer journey, there's so many different stages. You've got surgery, you've got radiation, you've got medical oncology. And the McGrath breast care nurses are that one health professional you can access, you know, from beginning to end.
In fact, that McGrath Foundation research show early access to breast care nurses significantly improve the experience and the outcome of the people with the breast cancer. And I really believe no one should face to breast cancer without care of McGrath breast care nurses.
Breast cancer is like climbing a mountain. It involves many steps. You're carrying a really heavy physical and mental load for months on end. And on top of that, I was diagnosed in the middle of a global pandemic. I think if I had not had the support of the McGrath breast care nurses, that experience would have been, you know, even more isolating. But instead I felt supported at every step.